Highly contagious and mutated Omicron variant has now been identified by more than 30 countries worldwide. It's spreading fast across the United States of America, with New York confirming at least 5 Omicron cases. President Joe Biden has shifted away from his booster shot campaign and has vowed to fight the new variant with, and I quote, science and speed. He's announced a pandemic strategy to confront a potential winter surge, which includes more vaccination centres, booster shots and free at-home COVID tests. New testing requirements have been announced for travellers. Biden has urged the nation, especially the political rivals, to try and unite.
Today, I'm back to announce our action plan to battle COVID-19 this winter. Not that any of us are surprised in interviews, because it's the combined advice from all of you that we developed this plan. And it doesn't include shutdowns or lockdowns, but widespread vaccinations and boosters and testing and a lot more.
The Biden action plan says that international travellers who will be entering the United States be tested within 1 day of flying. This will apply to all Americans and all foreign travellers, regardless of their vaccination status. Mask mandates have been extended on aeroplanes, trains and other public transport. This rule will stay in place now until mid-March. White House Press Secretary Jen Psaki has said that testing and vaccine requirements could eventually be added to domestic flights as well. The state of Hawaii is the latest one to confirm a case of Omicron. Before this, New York confirmed 5 new cases. This brings the total number of cases of this strain to 9.
We still don't have specific information on how the vaccines are holding up or the boosters are holding up to this variant, but it is real. We said it would be coming here shortly. We announced this morning that a case from Minnesota was directly tied to the city of New York for individuals who participated in a convention at the Javits Center between November 18th and the 22nd.
It's not yet clear whether the new cases are or near New York City, which is the country's most populous metropolitan area. At least one of the 9 cases have been confirmed in Minnesota. It involves a person who has no recent international travel history. Moreover, Colorado is the 3rd US state to have detected a case of the Omicron variant. A woman who'd recently travelled to Africa has tested positive there. The woman was fully vaccinated but had not received her booster shot yet. Apart from this, California has also confirmed 1 case of Omicron. Well, to get you more on this, our correspondent Susan Tarani is joining us live from New York City. Well, Susan, I want to start by asking you, the Biden administration has now laid out this new plan. Is there any sense from health officials or just from the people that you've been speaking to that these measures are going to be enough to stop the spread?
So, Nick, as you mentioned, there isn't much known about this new variant, and it'll take about a few weeks until, according to health officials and health leaders in the United States, to understand more about how vaccines and the current vaccines on the market and available will be effective against the new variant. However, the fact that the Biden administration and President Biden himself laid out this new plan, and part of this plan is free at-home testing to be covered by health insurance companies, perhaps is an acknowledgement by the White House that his strategy of vaccination and vaccine mandates haven't been as effective as he had hoped in curbing this virus. And he's moving towards more testing for individuals across the United States because a lot of people have made up their mind and they lean towards getting the weekly testing as opposed to being pressured into vaccination and vaccine mandates. And it's something that I think this administration has realized that is not working, especially because of the pushback that it's facing psychologically and in the polls and from the Republicans on the one side, and on the other side, just scientifically, again, there isn't much known whether or not the boosters and the vaccines are effective against this variant or not. But here in New York, I think, as you mentioned, in terms of, what local leaders are doing, New York Governor Sorry.
And Susan, we're seeing more cases appearing, I guess, in more states, as you mentioned, and in New York as well, really seeing more cases by the hour, by the day. How concerned are people when so much is unknown about this new variant? How concerned are people about what they're seeing?
Yeah, it's interesting you asked that. Just before our broadcast, I was speaking to a few people here in New York City, and they were saying that everyone's been really hyper aware of this new variant, and what has really stuck out in the people's mind is that it's very transmittable, but also they've noticed that whoever has been affected and infected with this new variant, their symptoms have been mild. For example, here in New York City, the 5 people that we know of, health officials and government officials have told us that their symptoms have been mild. They've been resting at home. So that's sort of been a sense, has created a sense of calm among the New Yorkers that I've spoken to. They've said that they're going to go about doing what they're doing, washing their hands, social distancing, wearing masks, getting the vaccine, getting the boosters, and just doing what they've been doing so far, and going about their daily lives. I think there is a sense of exhaustion, a COVID exhaustion at this point. And with Governor Kathy Hochul saying that, quote, this is at a press conference last night with New York Mayor Bill de Blasio, by the way, we are not defenseless against this variant at all. We're not having shutdowns. We're not changing our protocols. That sort of put people at ease. But I do want to say that New York does go into a state of emergency today, which is Friday. What that means is that city officials and local officials and state officials will be on a state of high alert, and hospitals who will have beds, who will not have, who will have less than 10% available beds will have to halt elective surgeries in order to have available beds for possible COVID patients.
Thank you, Susan. That was Susan Tarani joining us live from New York City.